All right. So I'm Erin Riggs. I'm actually going to talk to you about a different career path in genetics, genetic counseling. But before I start talking to you about genetic counseling, I just thought I'd take a moment to set the stage. And I think that this question is going to be relevant to anyone in the room, whether or not you are a medical student or you actually are a physician. But how often has this happened to you, where either you or a member of your family have gone to the doctor for something and the doctor is trying to explain to you either what they think is going on or what they'd like to do or some kind of follow-up, and you just have no idea what they're talking about or just cannot wrap your head around the things that they're telling you. And I'd venture to say that this has probably happened at least once to everybody in the room, and it probably happens more often than any of us would like. In all aspects of medicine. But in genetics in particular, this happens pretty frequently. I mean, a lot of people don't have a baseline working knowledge of genetics, and when they're coming in to see a clinical geneticist, it's often because something serious is going on, and so they're already in that mindset of worry, panic, fear, and it's often hard to digest the information in that setting. So this is where genetic counseling comes in. As defined by the National Society of Genetic Counselors, or NSGC, genetic counseling is the process of helping people understand and adapt to the medical and psychological and familial implications of genetic contributions to disease. So you can kind of think of genetic counselors as the interpreters, if you will, of this complicated genetic information. And so we often help patients and families to process things like, what is this diagnosis that I've just been given? What do these test results mean? What are my risks for developing particular symptoms associated with this condition? What other clinicians do I need to get involved in my healthcare? Which of my family members may be at risk? And many, many more. So genetic counseling is actually a profession that's in demand, and there's been about an 88% increase in certified genetic counselors since 2006. Currently, there are about 4,000 certified genetic counselors here in the U.S. The U.S. Bureau of Labor Statistics projects a growth rate of 29% for genetic counseling compared to 7% for other professions as a whole. So that's pretty interesting. It's a hot field, and there'll always be a spot for you if you go into genetic counseling. To become a counselor, you need to obtain a specialized degree from one of the 41 genetic counseling training programs in the U.S. and Canada that are accredited by the Accreditation Council for Genetic Counseling. And these are master's level programs. They're typically about 2 years in length. Clinical training programs. And usually in order to get into one of these programs, people need to have an undergrad degree in either biology, a social science, or some other related field. They also look at things like whether or not you have volunteer experience or experience working with people in crisis situations. There are personal statements and interviews kind of similar to the other career paths that we've heard about as well. Once you become a genetic counselor, you will have to sit for a certification exam by the American Board of Genetic Counseling, and then to maintain that certification, you need to obtain continuing educational requirements. The NSGC, which I mentioned earlier, is our professional organization, and its mission is to advance the various roles of genetic counselors in healthcare by fostering education, research, and public policy to ensure the availability of quality genetic testing services. So the genetic counseling process integrates the interpretation of family and medical histories to assess the chance of disease occurrence or recurrence, education about inheritance, testing, management, prevention, resources, and research, and counseling to promote informed choices and adaptation to the risk or condition. And the genetic counseling model is one that may be different from your typical medical model that most patients would be familiar with. So the genetic counseling process requires participation from the entire family. And although counselors and the physicians that they work with may make recommendations about which tests we want to do or other management decisions, we actually really work closely with the patient and the family to help them understand what the options are, help them make informed decisions, and make sure that those decisions are in line with what they are hoping to get out of the entire experience. Counselors can also anticipate and help patients with common psychological experiences, such as, parents that are experiencing guilt or shame at a particular diagnosis, transmitting a particular variant, grief or sadness, worries about how to tell other family members about the diagnosis, etc. And genetic counselors function as part of a healthcare team. And although most often we work with an MD medical genetist or other specialty physician, depending on the particular area where a counselor is working, they can interact with anyone that you see here on the screen, such as students, other patients and families, other healthcare providers, the laboratory, third-party payers, people in medical records, the literature, databases, etc. So the majority of genetic counselors, or about 70%, actually see patients clinically, offering face-to-face genetic counseling. However, genetic counselors can be valuable team members in a variety of different settings, including those listed here, and the types of settings in which counselors work is continuously expanding. So now that I've given you a little bit of background on what genetic counseling is, I'll follow the model of the others and tell you about how I got into this particular career path. So I first remember learning about genetics maybe even in middle school, and I always thought it was just the most interesting subject that we ever talked about. So I was already interested in it, and then in one of my high school textbooks, they actually, in the little resources section at the end, they said, oh, for careers in medical genetics, contact ACMG or ASHG. And this was back in the time when you actually mailed people things. So I sent off, I wrote a little letter, I'm interested in information, I sent it off, they sent it back. I was reading about all the options, the medical geneticists, laboratory geneticists that we just heard about, but also genetic counseling. So I was very interested, and I was lucky enough to be able to shadow with a medical geneticist and a genetic counselor when I was in high school. They both did great work and just reinforced that genetics was something I was interested in. But then, around the time when I started applying to college and started really seriously thinking about it, I realized I don't really like blood. So that's probably a problem for a physician or a nurse or anything like that. So I decided to go more in a route in something where I didn't need to be involved with blood. So genetic counseling was a good fit for me there. So I knew that I wanted to do that when I actually started college, so I tailored the rest of my experience to that. So I got my bachelor's degree in biology, and then I went on to get a master's degree in genetic counseling at Northwestern University. And from there, I spent about 5 years at Emory University in Atlanta. I was actually fortunate enough to work with Dr. Adam. And that was where I gained most of my clinical experience. So I worked in the clinic, focused on general pediatrics and also lysosomal storage disease, and really worked as a team member with Dr. Adam and kind of to talk about what our day-to-day might be like. We would both prepare for the patients in advance, kind of review what they were coming in for, their records, et cetera. I would go in first, get all of the information, try to elicit the information that we needed to make a diagnosis. So we kind of go in with some ideas, and then we'd have to get additional clues to either confirm our original thoughts or see if we need to go into a different direction. And then I'd tell her what I learned, and then I'd tag out, she'd tag in, go in, do the examination, make the final call, and then I would help prepare all the follow-ups. So whatever testing we needed to order, if we needed to order in images or things like that. But during that time, I actually transitioned to research. So I started moving out of the clinic and more into the research space. And from there, I've actually, for the last 5 years, worked as a research genetic counselor at Geisinger, and I'm able to work remotely from home in Huntsville, Alabama. So now I spend all my time working on a project called the Clinical Genome Resource, or ClinGen, which is an NIH-funded project looking to create a centralized knowledge base for clinically relevant genes and variants for use in precision medicine and research. Regardless of the position that a genetic counselor is working in, I think they often perform the same types of key roles, which would be education, support, and advocacy. So even though I don't see patients anymore, I still think these things apply. When I did see patients, they played out in a really obvious way. So I would educate them on things like specific diseases or inheritance pattern or testing results, what have you. I would support them through difficult times as they're going on a diagnostic odyssey or having to disclose a diagnosis to family members for the first time. And I'd advocate for them with other physicians that may not be familiar with their particular condition, or school systems, or even in one case with the electric company, when I had to plead with them not to turn off a lysosomal storage disease patient's power when they had thousands of dollars of drug in the refrigerator. So that would have been a mess. But now that I work in the research setting, I still do these things, they're just in a different way. So the education that I do now is more with other professionals as I educate them on how to use the resources that we're developing through ClinGen. But I feel like we still support patients. Within ClinGen, we have a patient registry called Genome Connect, where we actually empower patients to participate in the data sharing aspects of our project. And we also advocate for them by encouraging other research projects, other clinicians, other laboratories, et cetera, to do the same. And that's it, and thank you for listening, and I hope you'll think of genetic counseling.